managing diabetes beyond the doctor's office, what you're not being told. So hi everyone, thanks for joining us again today. We're talking about something that isn't discussed enough with regards to diabetes care, and that's what happens beyond the doctor's office. So most people are diagnosed with diabetes, they get a short visit with their primary care doctor, and maybe they're given some brief instructions along with this diagnosis. They're given some equipment to check blood sugar. They might be given some medication, maybe a pamphlet with takeaway information. That's pretty much the extent of it. It's kind of like, it is what it is, and we'll check in with you in maybe a month and see where you're at. I think a lot of people kind of feel lost and maybe scared and confused for sure. My name's Dale Stern. I'm a board certified internal medicine doctor, and along with my partner Jennifer Stern, who is a nutritionist and personal trainer, we have between the two of us have worked with thousands of people, clients, patients, as far as helping them make real good lifestyle changes, healthy lifestyle changes. I've also helped diabetics manage their medications as well, which is also very important. But today, we wanted to kind of share with you what kind of gets missed in the traditional setting as far as people going to see their doctors and kind of what happens in the aftermath of that doctor's visit.
So let's start at looking at what typically happens in the doctor's office. You've been diagnosed with diabetes. Your doctor did a lab test that includes your A1C, which is the average of your blood sugar over the last 3 months, and probably spends about 10 to 15 minutes with you, letting you know your results, gives you a prescription for one of the common medications, and tells you make some changes to your diet and check back with me in 3 months. Let's see how you do. While doctors do their best, we know, they got into the profession to help people. We're not trying to knock that. They are limited on time. And so you're getting 10 to 15 minutes, but that doesn't include the real lifestyle changes and modifications really how you can improve and reverse your disease.
It's insufficient.
Right. Leaves people feeling unsure about their condition and how to manage it on a day-to-day basis. Yeah. And the medication is important, of course, but it's not the only part of the solution.
Well, it's not the long-term durable solution and plan that anybody really wants. I don't think a lot of people want to take medications. A lot of people are agreeable to take them, but if they're willing to, at that point, kind of pivot and realize that there is a lot to learn in which they can incorporate certain practices and methods.
Like diet, exercise.
For sure. But specifically, nutrition and building a routine and a regimen day to day, week to week, month to month that will kind of liberate them from being dependent on these medications in the long term is really the missing link there.
And that's not something that can be covered in such a short visit.
It's not. That's the problem is that a lot of doctors are very rushed for time because they have so many patients to see. Their compensation is largely based on volume, how many patients they can see in a given day. So that 30, 45, 50, 60 minutes that may be warranted or needed by you in the doctor's office is just not, it's what you need, but it's not what you're going to get. And it's not enough. It is insufficient. Why lifestyle support is essential for managing diabetes. Type 2 diabetes can be very much lifestyle driven if you really look at it, right? It's having a better understanding of nutrition, what you're putting into your body as far as food, the types of foods you eat, how much you eat, the way the food is prepared, all of these things that we kind of wrap up into nutrition. How frequently? Absolutely. It's not just as simple as calories in, calories out. It's like so many people believe, am I eating too much or eating too little?
How you move every day or exercise? Are you sedentary? Or are you sitting at a desk for most of the day?
Exactly.
Are you driving for an hour each day?
Yeah. These are real things. Absolutely. They add up big time.
And then how you manage stress. and how that
stress, absolutely. I mean,
has an impact.
It's so multifactorial. It's not just like, have you been good or bad about taking your medications? Again, like we said, the medications help. It's important to be compliant, but really that's kind of like one piece of this puzzle.
Right, but beyond the medication, there is so much more. Exactly. Yeah. And it can feel impossible sometimes to really get control.
I think the impossibility comes with the lack of knowledge, and that's not at the fault of the individual or the patient. Again, it's just going back to the fact that a doctor has not been able to take the sufficient time needed in order to put those other wheels in motion. That being, bringing their patient up to speed on how is it that you eat better, not just you got to eat better, or
right, because that's so impersonal too, like so impractical.
Right, or you should exercise more. Like, what do you mean by that? Do I need the gym membership?
There's an element of personalization that needs to happen. Like, let's have this conversation and what makes sense for me, right, where I'm at now, and meet me at that point and help help me to improve.
Right, exactly. So, if the medications are a starting point, the goal should not be for it to be the end point per se. So again, just going back to this idea of how to manage diabetes beyond the doctor's office. For starters,
let's talk about what you can do to take control. And here are some key areas that everyone can focus on.
Okay, so aside from the obvious, which we were talking about, medication compliance, let's talk about, again, nutrition being really a major cornerstone.
Yeah, forget restrictive diets because those don't work for anybody. Everyone's been there at a point where I'm going to do this and I'm committed and it works for a couple days, maybe a month, maybe 2 months, but it is so restrictive that it is not a long-term solution.
Yeah, I say it's like deprivation, like the sense of deprivation. It doesn't make for anything like that sustainable or durable.
I just even refer to the fact that people say I'm on a diet and off. It implies extreme, on, off, on, off. It shouldn't be like that. There should be balance. There should be some in between. And that's what we want to accomplish, is that in between where you don't feel like you're on something or you're off something.
Like I like to say, I think we even incorporate it in our personal lives, is that if you can pretty much be good about it 80 to 90% of the time, I think that is a kind of a wonderful goal. That's kind of a sweet spot that works for most people, no pun intended, but that's kind of a good place to be. And that's something that you can kind of work up,
Yeah. And instead of cutting, for example, like where you feel so restricted, as you mentioned, that you say, okay, I'm cutting out carbs, I'm cutting out all sugar. Well, that results in you thinking more and more about those foods and those items and craving them more. So instead of having this approach where you're saying it's all or nothing, maybe find a way to incorporate it and balance them with the healthier lifestyle changes, healthier diet, healthy proteins, healthy fats that you can
I think
consistently have.
For a lot of people, the big thing is the carbohydrate factor, because that's where a lot of those, very easy to break down sugars come from in the diet, right? And some people say I love eating pasta. Okay, eat pasta, but make sure you're eating a size that's appropriate. Maybe a small bowl, not a large bowl. And maybe make sure that you're having it with a piece of fish, and that maybe you're not using a tomato sauce that's got a lot of sugar in it. Maybe you make your own tomato sauce, or maybe just use a little bit of olive oil. It's kind of the way that you portion it, the way you prepare it, how much of it you're eating, how many times a week you're eating it.
Yeah,
so we're not saying we're not saying don't do it. We're saying there's a thing of moderation. And often at times moderation can be the hardest thing to achieve, but I think it is a great way to still be able to incorporate those foods that you really enjoy so that you don't feel deprived.
Yeah. Number 2, establishing an exercise routine, again, that works for you, something that is realistic, meeting you at the level you're at and starting to modify and add on gradually so that it can be sustainable. Like you're not going to tell somebody who's a beginner to start going to a CrossFit gym or running 100 minutes a week. They're just not at that point.
Or even, the idea of lifting weights for a lot of people, that's just not something that they feel is realistic for them or something that they're interested in doing.
Right.
And not to say that they can't, but you work with people who are a little bit typically more advanced as far as fitness level goes. But for a lot of my patients, I tell them just to simply walk.
I tell people to find activities they enjoy the most. And that's always what I've said when people say, oh, well, what's better, treadmill or elliptical? What's better, this spin class or lifting weights? In general, if you're somebody who's just starting out, find an activity you enjoy, because then you're going to want to do it more often. And consistency is really key in developing an exercise routine.
I agree. I think if it's something that you can start off doing, 2-3 days a week, you can build it up to 4, 5, and 6 days a week as you start maybe realizing some of these benefits that you're actually starting to experience as a result of being consistent with a process and a plan.
And that comes really within a matter of days to a couple of weeks that you start to notice your energy levels just improve. That's the first thing everyone notices within 2 weeks. Oh, I'm having more energy throughout my day. Absolutely. And I love that. Yeah. I love that. Number 3, incorporating stress management and mindfulness. So stress can have a major impact on blood sugar regulation. Absolutely. And often it's overlooked.
Yeah, absolutely. I think a lot of people out there, especially in today's world, they do their best to cope or ignore, but your body definitely feels it, whether you acknowledge it or not, that there is a great deal of stress that we are exposed to on a day-to-day basis. And this basically results in higher levels of cortisol in your body. When your body's exposed to cortisol on a consistent level, it will cause blood sugar dysregulation. It'll cause your blood sugar to, on average, be higher, which is really not what we're trying to go for. So sleep hygiene is important, eating right is important, and trying to, in general, observe a lower level of stress in your life, which is a bit of a trick. It can be easier said than done. But again, even something as simple as like you go for a 10 to 15 minute walk after dinner, the simple act of exercise can help you to de-stress.
That can. I mean, I love, even this morning I was feeling stressed rushing to work, and I put on some great music and like singing out loud to the music in my car. That helps me with stress. I'm listening to a good podcast, reminding myself to take 5 minutes if I haven't at the end of the day to just decompress. And even if it's taking that extra long shower and having some deep breaths, like that is stress management. Number 4, building consistency with small achievable goals. Setting yourself up for success means realistic goals. We're not talking about climbing mountains here.
Don't jump off the deep end.
Right. So starting small, focus on one change at a time. You know, maybe this week you focus on drinking more water, or waking up and drinking water is the first thing you do. And next week you try adding that short walk in. And the whole idea is this has a compounding effect. And over time, these add up and help you build lasting habits. There is an important factor here that we haven't mentioned, and that's the importance of community and accountability. So changing your lifestyle, we've both seen firsthand, it can be challenging, it can be daunting. You haven't done this your whole life, and now someone's telling you, you better change it up. And your life depends on it to one degree or another, right? So it is important. And so this is where community and accountability really come in. You have a support system in place to help facilitate and encourage you. You're more likely to stay on track. You can make better progress. You can stay motivated because you're going to have those moments where you don't feel like doing the things.
Yeah, it certainly helps to relate to others who are kind of going through something similar that you are experiencing yourself that may not be relatable to maybe other people in your family or in your friends group necessarily. So it is kind of nice to have that.
Yeah, and it's not just about having someone to check in with. It's about being a part of a safe, uplifting, encouraging space. Share your wins, talk about your struggles, know that you're not alone and you're really understood. And this is the kind of environment that makes sustainable change possible.
Agreed. So this is why we created the Diabetes Solution membership. With it, you will gain access to a comprehensive course set up in modules. It's about 80 minutes and it's self-paced, self-learning, comprehensive. It's everything that you will need to know in order to really tackle and put all the pieces of the puzzle together to better take control of your type 2 diabetes. And along it, you will gain community with access to our community space where you will be able to engage and interact with us, but also with people who are also looking to take better control of their type 2 diabetes. So with monthly live calls, you get to get online with us and do Q&A and also be alongside others online. And you'll have access to ongoing resources. We'll be able to provide meal plans, workout guides, and regular updates to help you stay on track. Most importantly, you have access to community. You are there alongside with people who are pre-diabetic or have type 2 diabetes who are experiencing and going through the same things that you are as well, which makes enriched opportunity. The goal is to provide you with the tools, guidance, and resources in order to make good, sustainable changes to your type 2 diabetes and your overall health.
Thank you for spending time with us today. I hope this session's given you a better understanding of what it means to manage diabetes beyond the doctor's office. You don't have to do this alone, and you don't have to feel overwhelmed. That's all for Real Deal Doc.